Welcome to our exploration of the fascinating parallels between the healthcare industry and the world of casinos. Today we will delve into how these seemingly disparate realms share surprising similarities, particularly in their reliance on high-value targets. A high roller, also referred to as a whale, is a gambler who consistently wagers large amounts of money in a Las Vegas casino. Whales are the key to profit in the casino business. It's not the hundreds of others dropping $50 on a slot machine. Since casinos absolutely need the high rollers to visit, they offer lavish gifts to entice them onto the casino floors, such as private jets, limousines, VIP suites, and free food and drinks. Those are called comps. A Healthcare Z recently put out a video calling the hospital patients who have private health insurance the casino whales of the healthcare industry. Hospitals love patients with private insurance. Private insurers pay much higher prices. They are clearly subsidizing Medicare, Medicaid, and other government-based policies that just do not pay the premium prices. Specifically, Dr. Eric Bricker highlighted the stop-loss contracts that hospitals issue to private insurers. They all but guarantee providers a premium rate for their services, especially if they are creative with their math. In this one example, the price for a heart surgery is set at $200,000 on the hospital chargemaster. A stop-loss contract with the private insurer says, as long as the total billed charges do not exceed $200,000, the hospital will settle for $80,000 as full payment. But get this, once the costs do exceed $200,000, the hospital is entitled to collect 70% of the billed charges. Adding 1 penny to those billed charges would make the bill $200,000 1 cent, and at 70% of billed charges, folks, that would net the hospital $140,000 instead of the $80,000 settlement number. The higher the billed charges go, the more likely the hospital will choose to switch over to the percentage of billed charges formula. So wait, if the billed charges were $800,000, that hospital could then collect 70%? That's $560,000. Not that a hospital would ever do that. Here's the kicker. The hospital walks away telling private health plans they just got a 30% discount off of billed charges thanks to their special pricing contract. Talk about a fiction movie. Employers, you better watch out for those stop-loss contract provisions. And this begs the important question of the day. Why are members of self-funded plans the casino whales of the insurance world? And why do hospitals and providers take advantage of them by shifting costs from Medicare and Medicaid over to the private employers? Because they can. Medicare provides the volume of patients for sure. Hospitals are limited in what they can charge Medicare, but there seems to be no limit to how much hospitals can charge self-funded employers. This cost-shifting fraud has been going on far too long and only appears to be getting worse for privately funded health plans. So look out, employers. You are currently subsidizing unprofitable government programs like Medicare, Medicaid, and Medicare Advantage. Members are paying more for every procedure because they are the casino whales of the healthcare ecosystem. And let's not forget the old maxim, the house always wins. And that means self-funded employers always lose, getting stuck making up the difference. By the way, you self-funded employers are not even getting comped. That sneaky stop-loss contract provision and phony 30% discount are not comps. You missed out on the private jets, limos, and VIP suites. Do not become a high-value target. You need to speak up now. We at FinHealth can help you do that. We can show you what fair pricing looks like using our prepayment claims analysis before you send big-ticket payments out the door. Contact us today at sales@finhealth.com.